In an art gallery in New York City, we met the Pippins, the signature creation of the late artist Charles Winthrop Norton during his time in a mental health facility. The fancily dressed Pippins, some even sporting designer shoes, all display a thumbs-up gesture in the front while hiding a bleaker middle finger signal behind their backs.
I think it represents also the fact that people on the front are all okay. You know, they hide, but in the back, that's the true color of the people.
Just like when her son Charles was navigating mental illness before taking his own life. Looking back, she still can't point to the exact time Charles first experienced depression. For a period, she dismissed her son's struggles only as a teenage phase. But the phase never passed.
I didn't know. I Googled things and I didn't know where to find a doctor, how to find a good one for this age, for this. Well, I found some, but we had just arrived because we were in Toronto. It's difficult when you are on your own and you don't know. It's hard to find access. Mental illness is so complex. It goes from depression, but depression is one thing, but it triggers other problems.
The American Foundation for Suicide Prevention lists suicide as the 12th cause for all deaths in the United States. However, only in 2020 alone, there has been about 1.2 million suicide attempts. And over the past decade, there has been a significant increase of suicides among people aged from 25 to 34. With the pandemic taking its toll on so many aspects of daily life, including in-person mental health services, many professionals worry that the worst is yet to come.
I think the fourth wave of the pandemic is a mental health wave. A lot of people say that. And I'll tell you what I'm seeing, sadly, that gives me some indication that we're only at the beginning of it. The recent spate of suicides that we've seen. I know that suicide was already on the rise prior to the pandemic, in certain communities in particular. There's so much need, and there's so many people who are not getting help at all, both by choice and because they don't have access. I don't know that we in the U.S. have all of the resources that we need, and that we're directing the resources to the people who need them